What's good, YouTube? My name is Jay, and I'm back again with another video. Now, I got to admit, I launched my first video on the 1st of January, and it didn't come out so good. I had lighting problem, technical problem, and YouTube is not easy as you think. However, I'd like to welcome you to Respiratory Therapy Essential for the TMC exam. Everything we talk about on this channel and the information and content that we give is all about you passing the TMC exam. It doesn't matter if you failed it by 1 or 5 or 20. This station and channel will help you to pass the TMC exam on your very next attempt. Please stay with me, and I can assure you that the information that we give will be very helpful to you. Now, I don't have a whole lot of time, so if you're ready to go, let's do this. Tonight, I'm talking about flow volume loop. Pay attention now to the center of the board, and we'll get to the left and the right side later. On graph number 1, this is a normal flow volume loop. You have to know normal in order to know abnormal. And number 2, you will see what is called a short loop. This represents an obstructive disease. And graph number 3 is represented, we call it a tall or skinny loop, which represent a restrictive disease. Graph number 4 is round or pancake. Pancakes on the top, pancake on the bottom. However, it is identified as being a fixed airway obstruction. You usually see this pattern when there is vocal cord damage or some kind of vocal cord dysfunction, usually in cancer patient that have throat cancer. Now, you will see all of these on the TMC exam. You will see all of these on the TMC exam, and you have to be able to recognize them because the shape of the loop is actually diagnostic. So when you see one of these loop, you should automatically know that it's a restricted or obstructive disease. On the left side of the board is sort of an interpretation of these loops. So when we come to obstruction or obstructive diseases, your best test is going to be FEV1, FVC percent. If the FEV1, FVC percent is less than 70%, the patient is obstructive. It is your best test on the exam to determine whether or not a patient is obstructive, your FEV1 to FVC percent. If they don't give you the FEV1, FVC, then the next thing you want to look at is the FEV1 alone. And if it's less than 80% of predicted, your patient is obstructive. Obstructive impairment is less than 70% of predicted, FEV1, FVC percent. Whenever it's 70%, less than 70% of predicted, your patient is obstructive. Remember, normal is 85%, 70% is only minimum. So there you have it when it comes to obstruction or obstructive disease. On the right side of the board, I want to talk to you very briefly about your best test for restrictive diseases, which is the slow vital capacity or forced vital capacity, all the same. The next best test is the forced vital capacity, okay? Your best test for restrictive, slow vital capacity, your next best test is your forced vital capacity. If the FVC or the forced vital capacity is less than 80% of predicted, the patient is restricted. If the FVC is 80% or greater, the patient is not restricted. Now, on the TMC exam, you will definitely run into this scenario or situation. The SVC or slow vital capacity should never be higher than your forced vital capacity. You'll see that on the exam because this means that there was poor patient effort and you should repeat the test. You will have more than enough questions when it comes to obstructive and restrictive disease. And remember that you have to also continue to study the degree of severity. So there's mild, there's moderate, and there's severe obstruction. There's mild, moderate, severe, restrictive. And there's also obstructive and restrictive. What I'm showing you tonight and what I'm doing in my video, giving you the very essential thing that I know you will see on the TMC exam. You will see all of these flow volume loop. You need to be able to interpret them. You need to be able to recognize them, because when you recognize them, then you recognize a diagnostic process with your patient, and you have to treat the patient accordingly. Okay, guys, I'm back. That's flow volume loop. What you see on this board, you will see on the TMC exam. Now, I don't want you to take notes. You took notes through school. You took notes through seminar. You can screenshot the board if you like. But all I want you to do to be able to have a quick reference to what you will see on a TMC exam. And if you master the thing that's on this board, you will have no problem when it comes to flow volume loop on the TMC exam. Hey, do me a favor, hit that like button and subscribe to my channel. Turn on the notification bell, because I'm going to be giving you more TMC essential for the TMC exam every single week. And you will pass the TMC exam on your very next attempt. And until next time,